So, join us on this journey of wellness, beauty, and health. A typical medical tourism itinerary begins with a pickup service at the airport. From there, the client is brought to their accommodation of choice where they can rest and freshen up. The client may then be brought to any one of the many sprawling malls in the city, where they can enjoy shopping and dining, among others. The next itinerary can already be a trip to a medical facility. If they are lucky, they don't even have to leave the mall to go to the clinic. This is because the clinic may already be in the mall. One such mall-based medical facility is MD Eastwood, headed by Dr. Juan P. Sanchez Jr. MD Eastwood houses a host of medical specialties such as dermatology, obstetrics, pediatrics, ophthalmology, pain management, ENT, and internal medicine, among others. It also has dental facilities and a wide variety of services pertaining to beauty and wellness. Dr. Sanchez takes us on a short trip through MD Eastwood's facilities.
This is our derma treatment room. Okay, we have two tables. On this table, those patients who will undergo intense pulse light treatment. We have an intense pulse light or IPL machine on that corner. On this side, we have a microdermabrasion machine. We call that diamond pill. This is the operating room. We do minor, major, medium, and major surgeries here, from plastic surgery to general surgery, ENT, etc. This is another specialty clinic occupied mostly by ENT. ENT guys, general surgeons, and other specialties.
Dr. Sanchez specializes in plastic and general surgery. He talks to us about his extensive experience in this field. Beauty has its own definition here in Quezon City, and we're about to meet Dr. Jim Sanchez, who's going to teach us about his definition of beauty, the Oriental way. Hi, Dr. Jim.
Hi, Corey.
I know you specialize in a certain look for Oriental women and men. It's not just a Western look on plastic surgery. What exactly is it?
Before they say that, if you have an Asian face, you must have an Asian nose.
Mm-hmm.
So
not necessarily.
Not necessarily anymore.
But why is it that it's not so obvious the way you do it? It's subtle and very appealing. How did you develop this kind of look?
It's over a period of time. Mm-hmm. There is evolution in my techniques. Mm-hmm. But I'm basically a conservative surgeon. Mm-hmm. I love art, and I want what I do on a patient, it should look natural. Mm-hmm. Foremost in my procedure, in my goals, is safety, mm-hmm. short term and long term. When I say safe, of course, there should be no risk to life. Second, when I say safe in a short term and in a long term, there should be no complication. So when I do it, when it in my experience, when it looks natural, it is safe. For me, I initially talk to the patient what she wants, and then I discuss to her my aesthetic stance. You know, I'm in my aesthetic field, and what to me is beautiful. And then from there we move. So if we agree, then I do the procedure. I toss between rhinoplasty and eye bag surgery. But before, when I was in my first 10 years of practice, it's rhinoplasty. It's oriental nose slip or oriental rhinoplasty. But more and more patients now want eyelid surgeries, like eye bag surgery.
That's right. Or they want a lid.
Yeah, they want a lid, eyelid surgery.
Doc, I know that the latest technology now in rhinoplasty is you have a choice, right?
Yes.
What are those choices?
Well, you have a choice. The most frequent, still they want silicone implant because silicone implants give a natural look. And it is easy, it is biocompatible, it is inert. So for as long as you know the principles, you won't get complications. And the other option is you get tissue from the patient, like you can get cartilage or bone, and you can get even dermal fat graft to increase, for example, the dorsum of the nose. But to me, these are all easy. Augmenting the dorsum of the nose is the easiest part. The only difference is if you have to do it, it's more of the contour, not the size that you put. To me, the more difficult is refining the distal third of the nose, so the lower half of the nose. That is the more difficult and challenging.
Yeah, because it will be obvious if it's been altered, right?
Yes. Virgie, hello.
Hi, how are you, sir?
Okay, what we're going to do is, I'm gonna get a nasal cast that is the replica of your nose. Something like this. It's a three-dimensional replica of your nose. So this takes less than 30 seconds. You have to assure the patient that it's safe and there's no pain. I am positioning the implant over the nasal dorsum. Okay. The incision is hidden, so you don't see scars. It's along the rim, the alar rim. Okay. The procedure takes about 15 minutes. Okay, in less than 15 minutes, as you see, we're done. And you have a refined looking nose. It is natural looking, okay, and it is soft, you know. It's soft. You can move it like this. It's soft. And there is no danger of displacement because it is fitted well. Alright, Virgie. Look great.
Thank you.
Did you feel any pain at all?
Nothing.
See? So it's absolutely painless.
Nothing.
All right.
Dr. Jim has perfected his own set of procedures and has authored some books in order to share his expertise with other practitioners.
I have written a book which is used by many doctors from all specialties like general surgery, otorhinolaryngologists, dermatologists, orthopedic surgeons, plastic surgeons.
Why did you write this book?
I write this book. It means that you can do big surgeries from head to toe without putting the patient to sleep.
That's fantastic.
Yes, it's just like acupuncture.